Today we're going to be talking about hypertension. So hypertension is high blood pressure, and it's just important to note that recently, well, not too recently, but maybe 3 years ago, the guidelines for blood pressure have changed and they've become more strict. So before 120/80 was normal, considered normal, but now to be normal, it has to be under 120 and under 80. And so 120/80 is now considered slightly elevated. So the thing to understand about hypertension is that, like other chronic diseases, inflammation and oxidation is the underlying mechanisms that is driving the disease. So think about anything that is inflamed. Your arm when it's cut, or your eyes when it's inflamed, doesn't it swell? So well, the swelling of the arteries cause the constriction of them, right? They're swollen, they're bigger, and the inside of it gets smaller. Think of a pipe. If it swells inside, it's less space for the blood to pass, and so the blood is past squeezing over there, so there is hypertension. And so inflammation can come from many sources. And it's important to identify the patient's source and work on that source so that you're just not giving them hypertension medication without fixing the source. And hypertension medication is needed. It's good. It's great. I mean, we don't want people having strokes and dying, but you do have to act on the cause and not just give them the hypertension medication. So let's talk about some of the causes. First of all, insulin resistance. So insulin resistance is a problem for many things, right? And in particular for arteries, it works in two ways. One, insulin is very inflammatory for the arteries. It damages the arteries. It causes them to be inflamed. So it swells up and then you get less space for the blood to go. But also it rusts the pipes, right? It just damages. It reduces the production in the vessels of nitric oxide, and that is a compound that causes vasodilation. Vasodilation is a good thing for hypertense people because then you're going to open up those arteries, and so the blood can flow a little bit more smoothly. And so also the last thing insulin resistance does is that insulin is responsible for carrying minerals inside the cells. If you are resistant to insulin, that means your cells are deaf. They cannot hear insulin. Insulin is knocking on the door and they can't hear it. And so minerals can't go into the cells. And the importance of minerals is that for cardiovascular function, it causes relaxation. So magnesium, potassium, it causes the relaxation and the dilation of your vessels, helping with hypertension. So insulin resistance is one of the causes. So if you treat insulin resistance, you are treating as well hypertension. And how do you treat that? Go watch the video on insulin resistance. Next cause, an obstruction. So you can get an obstruction in your pipes from plaque, from cholesterol. And again, insulin resistance is a driver for that as well, but also a bad diet full of saturated fat, full of especially trans fats. It'll form the plaque. And cholesterol has a role to play, but I explain a little bit better in the cholesterol video. So if we treat that with a diet, then we can treat the hypertension. Another thing that is not very investigated is sleep apnea. So sleep apnea is a great driver for hypertension. If you are not getting oxygen in your blood, you are damaging your blood vessels, right? Cells that don't get oxygen die, and so they get inflamed and they die. Another thing is that during the night, when you are breathing through your nose, you increase the production of nitric oxide. And nitric oxide is, again, that compound that does vasodilation. And when you don't sleep well, your cortisol levels, the stress hormone, rises. And cortisol makes your heart pump more and your vessels constrict. And so it causes your hypertension to go up, your blood pressure to go up. Which leads me to the next cause of hypertension, which is stress. So when you're stressed, your body responds by increasing your heartbeat and constricting your blood vessels. So your blood pressure goes up. You have more blood pumping in more tight vessels, and so your pressure goes up. That's why people, when they are already hypertense and they get nervous, they feel their head hurting a lot because their blood pressure goes up. So managing stress, calming down, deep breath. So studied nowadays, current science is deep breathing Forest bathing, so meaning going for a walk in the forest, it lowers your blood pressure. This has been studied. And meditation as well. But any other stress management techniques that works for you, if it's managing your stress, it's working for hypertension. So working on that. The next cause is low minerals. So for example, the population here in America is 45% of the people are deficient in magnesium. And magnesium is a relaxation mineral. We need it to relax everything, our blood vessels, our muscles. You know, blood vessels have muscles, right? They have a pipe, a blood vessel has many layers. One of them is a muscle layer because that's how you pump the blood throughout it's not just the heart responsible for that. Our vessels are actually pumping. And so you are having a problem with contraction as well there when you're lacking minerals. And it's not just magnesium. Potassium is a great antidote for sodium. So we think of sodium as something that raises blood pressure because it pulls water into the blood, right? It has that osmotic effect. Well, we'll talk about salt a little later, but potassium is a great antidote for that. So many people are deficient in minerals. And how do you become deficient in minerals? Well, you're not eating a lot of fruits and veggies. If you're eating a lot of processed goods, you're getting a lot of sodium and you're not getting a lot of the other minerals, which is calcium, magnesium, potassium, and then other little trace minerals as well. So we need to fix your mineral deficiency, and then we'll be treating hypertension effectively. Overweight and obesity, just because of all the fat that's in your arteries forming, all the insulin resistance that has been driving. So losing weight can actually reduce your blood pressure. Everything that generates inflammation. So the biggest source of inflammation in our body is usually the gut. So either because you're eating foods that are inflammatory or because you have an imbalance of bacteria in there, and then that causes 1, inflammation, 2, malabsorption of minerals. So you're not absorbing the minerals even though you're eating them. You can't have enough, and so the lack of minerals generates hypertension as well. Toxins and heavy metals are a very big source of inflammation. So working on reducing that toxic exposure, working on removing heavy metals from your body if that is the case. It's not the case for everybody. Alcohol and caffeine, because they are vasoconstrictors, they can elevate. They don't cause the hypertension, but they are a driver for people that already have it. So they keep it going, right? Smoking for the same reason, and no physical activity. Because when you contract your muscles, the muscles help contract the vessels as well, get the blood moving. It helps with insulin sensitivity. So when you work out, your cells actually receive that insulin and it's not floating around in your blood. It also helps you with absorbing stuff. So physical activity is very important. Let's talk about salt really quickly. So salt, most people are not salt sensitive, meaning they eat salt and their blood pressure rises immediately. Some populations, like African Americans, for example, are a little bit more salt sensitive. But now people are starting to wonder if that isn't because of they are also more insulin resistant. This is not very, there isn't a consensus on this. It's a hypothesis, but maybe it's that. Some populations are more sensitive. Yes, they should watch their salt a little bit more. But if you're using processed salt, that is the problematic one. That cheap, it doesn't matter if it's iodized or not, but like the cheap salt that is just sodium chloride, the refined salt. So that is just sodium and chloride. As soon as you eat it, it'll break down into sodium and chloride. As opposed to you having Celtic salt and rock salt and sea salt and Himalayan salt. Those not only have sodium and chloride, they have calcium, they have magnesium, they have iron, they have copper, they have the trace minerals. So you're getting a lot of minerals as well with these other quality salts. So salt is not exactly the problem. Processed salt is the problem. And usually it comes in foods that are very rich in carbs, right? Chips and crackers and stuff like that. So that drives insulin resistance as well. So the consequences, hypertension is very bad because it damages the small little arteries of your eyes so you can get blind, right? You can damage your kidneys because there's all these tiny little blood vessels that irrigate the kidneys. With the blood pressure, you go and you burst them, you damage them. So kidney problems and retina problems, and then stroke, obviously, and just cardiovascular problems in general, right? So it is needed to be treated The thing is that the treatment now usually is just giving you a pill for you to pee out more water so that your pressure goes down, or a calcium channel blocker or something like that, a beta blocker. But you're not treating the cause of your hypertension, right? And then you're going to be on a medicine forever and not treating the cause. So treatment, Mediterranean diet, so Mediterranean-ish, right? So lean proteins, more lower in grains, lots of fruits and veggies, a lot of olive oil, which is good for you, a lot of fatty fish, which has the omega-3s. Omega-3s are anti-inflammatory. They help with blood vessel health. They help lower your blood pressure. It's high in minerals, the Mediterranean diet is, and it's low in saturated fat, processed goods, and the simple salts. And it's high in spices. Spices it lowers inflammation and oxidation. Please use spices when you cook. Garlic. Treating with garlic, it does reduce blood pressure in studies. Exercise reduces blood pressure. More minerals in your diet reduces blood pressure, not only from fruits and veggies, but also maybe even a mineral supplement, like mineral drops in your water, or adding a magnesium supplement. So talk to your healthcare professional, and see about that. You have to treat apnea. If you don't treat your apnea, you're never going to fix your insulin resistance, and you're never going to fix your hypertension. You're just going to take medicine to fix the symptom. So treating sleep apnea, being sure that you breathe through your nose, because that's when you produce your nitric oxide. Treating the insulin resistance with diet, with lifestyle, with losing weight, with exercise, right? Losing weight is my next point. Managing your stress with deep breathing, forest bathing, and meditation. These are the 3 that have been studied, but I'm sure anything that manages your stress will lower your cortisol and adrenaline levels, and then fix that response of your body, of the heartbeat and the vasoconstriction and all that. And the shallow breathing as well, right? When you get nervous, you breathe shallow. So as supplements, we can use omega-3 fish oils, because they relax the blood vessels, they're anti-inflammatory, and they help with the cholesterol profile, working in that plaque inside your veins so you don't get obstruction. Vitamin D is very important, but sunlight, not just vitamin D, sunlight. The UVB rays produce nitric oxide. Isn't that amazing? We were not created to be inside buildings with artificial light all day long. Please get outside every single day. Coenzyme Q10 is great because it's an antioxidant as well. Vitamin C is an antioxidant as well and can help lower blood pressures in studies. So this is the general idea of find the root cause that is driving your hypertension. And yes, it is important and necessary for you to take your medication, but if the medication is not treating the root cause, you're going to be on this medication forever, and likely you're not going to control your hypertension as well as you would want to.